It's UofL Today on 93.9 The Phil. Here's your host, Mark Hebert.
And welcome to UofL Today with Mark Hebert on 93.9 The Phil. This is the show about all the great stuff going on at the University of Louisville and all the great people at the University of Louisville. We'll be talking to a few of them here on this program over the next 30 minutes or so. On the show today, implementation of the Affordable Care Act resulted in something new for Louisville's working poor. It meant they had health insurance. But that doesn't mean all of them understand what they have or how to use it. Some UofL researchers are looking at that health insurance literacy gap, particularly among African Americans, and they will be here to tell us what they found. But first, all of us who love sports also talk about how sports are governed. In Louisville, there's of course been lots of talk about the NCAA, but how about the corruption in FIFA and the International Olympic Committee? How come Olympic athletes compete for countries other than the ones in which they're citizens? What about Kentucky's High School Athletic Association and its rules? Well, Mary Helms is a professor of sport administration at UofL who has a class in sport governance and also has written a book about it. And she's here to talk about some of those topics. Mary, good to see you.
It is good to be back here again. Thank you for the invitation.
Always a lot of fun to talk sports and sport governance, right?
Yes, it is, particularly in a city like Louisville.
Yes,
it's a sports-crazy town.
Sports nuts here.
Yes, we are.
Yes, we are. All right. Well, let's start. You've written a book about sport governance. What is sport governance, and what's in your book?
Right. A lot of people have that question when they see the term sport governance. What does that mean? Well, right away, when they see governance, they think of the word government. And when you think about a government makes rules, sets policies, and that is exactly what we're talking about when we're talking about sport governance. Who makes the rules? How are the rules made? How are the policies made? What are the structures in sport? And at what levels do different organizations apply their policies? You know, there's a lot to sport governance, a lot of similarities to the legal system. In other words, the legal system, there's jurisdictions, right? There's federal law, there's state law. Well, in sport governance, there are local organizations like the Kentucky State High School Federation, like KHSAA. There are national organizations, let's say like the NCAA, and then there are international organizations like the IOC. Or FIFA. And so they set rules for those particular levels. So when we look at when study sport governance, we're studying policies, but we're also studying power. And I think that's what's very interesting, is determining where in sport organizations the power really lies. So the book is about that, and it's the 4th edition, so I'm very excited about that. I wrote it with a woman by the name of Dr. Joanne McLean, who is now she's at the University of Fraser Valley, which is outside of Vancouver, and so Canadian, and she is now the president of that institution. Okay. So that's my co-author. So if you live long enough, you get famous friends. It's awesome. So she is my co-author, and it has been wonderful to work with her through these 4 editions. She has a lot of international sport experience on the Canadian side. And we wanted a little bit more of an international appeal to the book, so it's not just U.S. It's pretty heavily North American, but we also have a good bit of international information in there as well.
What's an interesting tidbit out of that book that you think will grab people and say, either they'll say, yeah, that's a really screwed up governance structure that league has, or something that you can point to?
Well, I think here, of course, we have a lot of discussions about the NCAA.
Yes, we do.
Yes, we do.
And I know you want to stay away from
it. And I have to stay away from that. But you asked me for an example.
Yeah, okay.
And so, the NCAA, there's a lot of people that want to talk about their rule setting and all. But then you also look at, for example, right now with the NFL and the whole issue with the players and standing for the national anthem. So that's been in the news. And it kind of depends. With governance, it's about setting rules. And sometimes the interest is in rules on the field, but there's also in governance the rules off the field. Right. We could also talk about, should Major League Baseball have the designated hitter in both leagues?
Oh, don't get me started on that.
I don't get. Good. All right, there you go.
Going on that
See,
one.
You asked for a topic that would get somebody started. I'd found one, didn't I? So you could look at rules on the field, but really governance deals more with those rules off the field.
Right, and who has the power to make those rules, right?
That is correct.
Okay. All right, again, we're talking with Mary Helms, who's a sport administration professor at the University of Louisville and has written some books and done some work on sport governance. You mentioned NFL. Back in the news again. They just can't seem to make this go away. To my view, they've totally mishandled this whole national anthem, the kneeling, all that stuff. It's turned into a political football. Now they come back and said anybody who kneels during the season will be punished, perhaps get suspended. How do you view that, and who has the power? Is it Roger Goodell, or is it the coaches? Is it the owners? Who has the power to decide, all right, here's what we're going to do if the players do this?
Right. Well, what you have to look at, particularly in professional sport, whether it's in the NFL or Major League Baseball or the NHL, whatever, or the NBA, you've got two different groups that are wielding power. So you've got the management side, but you've got to remember that everything has to go through the players' associations. Mm-hmm. So there's got to be, the two groups which are oftentimes in conflict have to really collaborate to work together to reach a solution. It's very easy for us as outsiders to say this is what you should do. Personally, if you're asking me what sort of my take would be on it, then I look at college football, and we've all been to college football games. Where do you see the players during the national anthem? They aren't on the field.
That's true.
They are not on the field. Now, it would seem to me that a possible policy solution for this would be simply players aren't on the field until after the anthem. Now, basketball,
that would work for the NFL. Yeah, but it can't work for basketball or
right.
baseball. Baseball, the players are out on the field during the national anthem.
Yes, and that's and there's so much tradition there with baseball having the players always out on the field. But that would be one possible solution for the NFL. But again, that involves logistical questions of changing times, and in terms of your blueprint for the games, there's always an agenda for when everything happens at a certain time. Okay, but those things can be changed. They've changed over time. So that would be, my thought, if I could advocate for something, would be to say players come out after the national anthem, and that's fine.
And that's probably what the PR geniuses are probably saying too. Let's do this, but whether the players and the owners will go along with that, that's a different story.
Yes, that's exactly right. And again,
are they too far into the controversy now that if the players are not on the field during the national anthem, it creates more of a controversy than if they were?
It draws more attention. Yeah. And typically, when you're a sport managers really like better to be behind the scenes. They're not the ones that are out front.
Yes, they do.
If we are out front, that means something's going on. Yes.
Another topic: the NCAA has changed its transfer rules recently. I think it was in the last year, wasn't it? So, what has that meant, and who made that decision that it's okay for Division I athletes to transfer? Let's see. First of all, what was the rule change? I'm trying to remember in my head here, and then who made that call?
Well, when you look at the NCAA and how its governance structure operates, it is interesting in that the members of the NCAA are the institutions and the conferences. So it's not individual people. A lot of times say, well, the NCAA does this or that. The NCAA is made up of institutions, and that is where the power lies. So those kind of decisions, any changes in the rules that are going to have to be made are going to have to go through different steps where the membership is going to have to approve those. So people who are the sport managers, the athletic directors, they're not the ones that are making those decisions. That's almost, I don't want to say bottom up, but it's driven by the membership. That's where the power lies in that, and the voting, and like the president's councils and all that. Right. So that is that's a different governance structure than, let's say, like the NFL or Major League Baseball that will have owners meetings, and the owners will meet. And of course, there's no at this point in college sport, at least there's no players unions.
Right, but what is the transfer rule? Do you know what that transfer rule is?
Well, it's a little more complicated than I could get into right now.
But it allows more Division I athletes to go directly to another Division I school without having to sit out a year.
Yes, that's what the discussion is going to be. And of course, you can make a parallel to that if you want to. A coach can leave at any time. And go to another school and start. But why do we say that an athlete?
And have people
and there's reasons. That. And there's reasons behind it. But it's a rule that they're continuing to discuss and to tweak.
Let's talk about the IOC, the International Olympic Committee, and how they pick where the Olympics are going to be held every 4 years. Who decides that? How do they decide that? And who's taking bribes?
Well, I'm better at the first two than that last one.
That may have been a little editorial comment.
I think so. All right, so the way that happens is that the IOC, the International Olympic Committee, is governed by what's called the General Assembly, and they meet regularly, at least once or twice a year, and they make certain decisions, and those are representatives of the different countries that belong to the Olympic movement, and that's the body that makes the decisions. And there's typically about 200 members, I think, in the IOC, but only about 95 are present for the vote. That's just how it works. Different countries come on and off of that governing body at different times. But that's where the vote will happen. The IOC meets in their General Assembly, and actually the two biggest things that the IOC does, two biggest decisions that they make, one is the location of the games, and number two is that they also decide what sports are going to be on the program. Because as you know,
sports take some off.
Yeah, like for example, in 2020,
Frisbee getting added or something.
Well, you never quite know. It's interesting with in Tokyo 2020, baseball and softball are back on the program.
Yeah, they were taken off.
They were taken off after 2008, and actually, I worked when I worked the Olympic Games in 2004, I worked softball. Right. And then they were taken off after 2008. Right. But that's another big decision that governing body makes.
But the biggest decision is deciding where the games are going to be.
Yeah. And there's been some controversy about that. Typically, the games were decided on 7 years in advance, and they chose one city to do that. The issue has been that there have been fewer and fewer cities are wanting to put their names in to host the games, and part of that is because they're really the economic impact. Is the economic impact of hosting the games really what organizing committees say it is? Well, there's some big questions about that. There's some short-term gains. You got short-term gains in
construction costs.
Well, you got construction costs. So you're going to have jobs in construction. Mm-hmm. But of course, what you also have to remember is when you are building venues or infrastructure for an Olympic Games, you're not necessarily creating a new workforce. You might be transferring a workforce who might have been doing something else, and now they're building. They're building arenas or infrastructure for the games. So it's not maybe new money. It's a transfer within the economy. But the IOC will look at cities that will be able to sustain a legacy after the games. They're also going to look at cities who have facilities in different states, different states of construction. So, for example, facilities can be considered that the IOC will look at. They can be considered Olympic ready, or Olympic ready with renovation, or needing to be built, that they don't exist at all when a city is trying to put the bid in, years in advance. And that's a big consideration. That is something that really helped Paris for 2024 and also helped Los Angeles.
Because they already had all the facilities, basically.
Yes, that was a big thing. There's going to have to be some upgrade to the facilities, but for the most part, a lot of that infrastructure is there. And it's not, we only think about the competition sites, but you have to remember that for all the competitions, you also have to have practice venues.
Right.
And a place like Los Angeles, for example, has lots of colleges and universities where different countries can practice. So,
well, the IOC, their structure is similar to FIFA's in terms of governance. Mm-hmm. Are either of those, and of course we know about the bribery scandal with FIFA, that the folks were getting bribed to pick Qatar, and Qatar was spreading money all over the place to get the votes to host the World Cup. Are both those organizations susceptible to bribery and malfeasance and those kinds of things?
Well,
by the way they're set up?
It's not. I want to say it's so much maybe by the way they're set up, but it's the amount of money that they're dealing with. When you think about the potential to bring a multi-billion-dollar sporting event to your country, that's a lot of pressure. And people are going to want to do whatever they have to do sometimes to get that event to come to their country. And it's really driven by the fact that, no one is concerned as much about if it's maybe a sport that's of lesser stature. But we're talking about the Olympic Games, we're talking about football, about soccer, think about all the exposure your country's going to get. Some tourism bump. I mean, there are some benefits, of course. So I think the pressure is driven from the amount of money that we're looking at, and that would even transcend sport. I mean, if you're a business that wants to relocate somewhere, if you're talking about multi-billion-dollar amount that you're going to bring to a country, that's where the pressure can come in.
There were a couple other things I wanted to ask you about. We're not going to have time to do it, but I do want to ask you about what do you teach in your class, and why is a sport governance class important to the students that are taking sport administration majors?
Okay, so what I do in the class is that we learn about all these different sports organizations. So we'll learn about the governance of high school sport, campus recreation, intercollegiate sport, international sport, and professional sport. We'll learn a little bit about the history of some of those organizations. We'll learn about their rules for eligibility, There are rules for membership. We also, they'll really address a lot of current issues because that's the policy side, and talking about the different policy issues that sport managers have to face when they're working in these organizations. You have to remember with sport governance, it's a big picture, and it's a big picture class. It really makes you think about where your organization, where you fit in the organization as a sport manager, where your organization is nested within the industry. But you also have to know the rules. You know, if you're someone that works, I don't know, let's say for a bank, you have to know some rules, right? Like FDIC rules or whatever.
Yeah, minor details.
Yeah. But if you are even an intern at an NCAA institution, you have to know the rules.
Yeah.
Because, you know,
so this
they
is
apply to
preparing
everyone.
all these UofL students in sport administration if they get out and work for a professional team, the NCAA, wherever they're going, college or university.
Yes.
This should prepare them to say, hey, got to know the rules, and you got to know who's making the rules.
You got to know where the power lies.
There you go. Okay.
Yes.
Mary Helms, always great talking to you. Always a lot of fun.
Thank you.
Well, whether you think the Affordable Care Act was great or terrible public policy, it did result in millions of uninsured Kentuckians and Americans getting at least minimal health insurance coverage. But do they understand what they have, and do they understand how to use that insurance coverage? Ryan Combs and Baraka Muvuka are both with UofL School of Public Health and Information Sciences, and they've been looking at health insurance literacy gaps, particularly among African Americans. Welcome to both of you to the show. Appreciate it.
Thanks.
All right, so what do you guys do? First of all, what are your jobs? What do you do for a living?
So I'm an assistant professor in the School of Public Health in the Department of Health Promotion.
All right, Baraka?
And I'm a student. I'm a doctoral candidate in health promotion and a graduate research assistant as well.
Okay, where are you from?
I'm from Congo, the Democratic Republic of Congo.
And you've been in the U.S. for?
For about 5 years now.
Okay.
Yes.
Okay. Well, glad you're here.
Thank you.
All right, I hope you're learning something.
Yes, so
at the
much.
University of Louisville. All right, well, let's talk a little bit about this research study that you did. Now, Ryan, why don't you go first and tell us what was the purpose of this study? What were you looking at?
Sure. So we were looking at health insurance and health systems literacy gaps in African American populations, specifically focusing on four neighborhoods in West Louisville.
And when you're talking about health literacy and health insurance literacy, what are you talking about? What does that mean?
So health literacy is the ability to obtain and read and understand and use health information in order to make good decisions about your health. So when we're talking about health insurance and health systems literacy, basically what we're talking about is, can you choose the right insurance plan? Once you have insurance, do you know where to go? Do you know whether to go to the primary care physician or the ER, that sort of thing?
Okay, and Baraka, what was your role in this whole thing?
So I was really providing assistance. I helped with some recruitment, data collection, and data analysis for this project, providing some support to the project.
All right, so this was after Obamacare was passed, and this was after you did the study after thousands of people in Kentucky, including the west end of Louisville, got some at least minimal health insurance coverage, right? All right, so you go do this survey. How did you do the survey, and what did you find?
So it was a qualitative study. So what we did is we actually had we had conducted focus groups. So these are like discussion groups with community members. We actually had held these groups in like 4 West Louisville neighborhoods. So we had them in California, in Shawnee, in Parkland, and in Russell neighborhoods. So we were able to recruit a total of 87 residents to participate in 2 rounds of focus groups, so 12 focus groups total. So the first round actually explored their experiences with health insurance in general, with navigating the healthcare system. What kind of barriers or challenges do they encounter along the way? What kind of information do they need? What works for them? And during the second round, we were able to to present these findings back to the community members and to get their feedback on what would work best for them in terms of delivering health information.
Okay.
Yeah.
So what'd you find? What were their attitudes and their ability to use their health insurance and how they used it?
Dr. Combs can talk about that.
Sure. So we found a number of things. The first thing is really that I want to start out by saying that health insurance, the healthcare system in the United States is among the most complicated, if not the most complicated, in the world. So really, none of us seem to fully understand every...
I don't understand what I have to do copays for and what I don't. I don't get
Absolutely,
all that stuff.
absolutely. So we very much found that people had difficulty choosing, understanding, and using their coverage. Speaking of copays and deductibles and so on and so forth, people really didn't know how much they would be paying for certain services. So they might receive a surprise bill. And of course, if you don't have a lot of money, a surprise bill can have a catastrophic impact on your life. We also found that people in West Louisville in particular have a mistrust of the healthcare system. The healthcare system is not always done, especially things like health insurance companies and things. Those surprise bills really have meant that there is a mistrust of what are you trying to sell me? What's the catch? So we did find a mistrust of the healthcare system and different providers and so on. Participants in our study had difficulty accessing the information about their health plans.
Meaning what? I mean, they couldn't find it online, or didn't know how to go online to find it, or didn't have enough information in the mail. What?
So what that means is that people, when they received health insurance information, they couldn't necessarily navigate it. So
it's too complicated. They couldn't figure it out.
It's too thick, for one thing. So when you sign up for a health plan, they give you an extremely thick booklet of all of the different rules and regulations around your health plan. Those are basically, I think, for most of us, used as doorstops or something. So basically, they couldn't find the information they needed within them. It's information overload. So that was an issue. Other things, there were perceived differences between public care and private care. So people who were on Medicaid felt like the health care they were provided was much different and of inferior quality to what they would have gotten if they had a private plan.
So the doctors weren't as good, the nurses weren't as good that they were seeing, or those kinds of things?
Yeah, well, it was things like not having the choice. People, for dentistry, for example, there are a very small number of dental providers on public insurance, whereas if you have private dental insurance,
you can go to anybody.
So things like that.
Gotcha. Well, that makes sense.
Yeah.
Okay.
And then the final thing that we found was around their information delivery preferences. So how do people want to receive health insurance information?
Okay. All right. Again, we're talking with Ryan Combs and Baraka Muvuka, who are both with UofL School of Public Health and Information Sciences, and they've been looking at health insurance literacy gaps, particularly among African Americans in West Louisville. Of these folks that you surveyed, that you had come in for these focus groups, were they all folks that had insurance through the Affordable Care Act? Were some of them on private insurance? They were, in other words, perhaps working poor, but they also had insurance through their companies. Who was this mix of people that you talked to?
So the majority of them actually gained their health insurance through the Affordable Care Act. The majority of them were on the public health insurance. We did have some people who had private insurance, but that was really a small proportion of our participants.
Mm-hmm.
Yeah.
I'd also say that this was a real mix. So West Louisville has a mix of folks living there. There is disproportionate poverty, but a number of people who participated in our study didn't live in poverty. So it was a real mix of folks.
Okay, so you had a mixed bag of folks.
Mm-hmm.
And you said a lot of folks just didn't understand what they had. Did they not know that they had deductibles, or was it that basic that they didn't understand they had deductibles, or they had to pay a copay, or was it something bigger than that, that if they had surgery, they had no idea how much it cost? Because I would have no idea if I had a surgery how much it would cost. Was it basic stuff, or was it things that were much more in-depth?
In general, people expressed that they knew the definition of a deductible and a copay. So it wasn't that they didn't know what it was. It was they didn't know how to calculate it. And I think that is a real universal issue. Mm-hmm. When you think about copays, deductibles, co-insurance, premiums, and so on, there was just a real lack of understanding about when they signed up for this, what was the impact. So that's really where we're going.
Yeah, and there's actually a gap between understanding something and being able to use that information, and that's what health literacy is all about. So being able to use that information to make decisions about your health care.
And when they stumbled across something that they didn't understand, did they pick up the phone, or did they have the ability to go to a website and look up things, and was that good enough? Or did they prefer to want to talk to, show up at the office of the doctor or Passport or the health insurance company and ask questions in person? What was the deal with that?
Well, I could talk a little bit about what they would like to do versus what doesn't work for them so well. So we found that in general, the existing methods were not preferred by this community. So handbooks, as I mentioned before, are overwhelming. They felt like call centers were impersonal. You might call one day, get one person, they tell you something, call the next time. Once again, something that I'm sure all of us can relate to.
But were they getting the information from a call center? If you pick up the phone, call the 800 number, were they getting You know, they might get one person that says, yeah, you have to pay a deductible on that on Tuesday, but on the next day, somebody else says something else. But were they at least getting something that they could understand from those call centers?
Well, the way that we asked the question was really about preferences. And so we asked them about all these different types, and they were allowed to come up, I mean, not allowed, but they were able to come up with their own suggestions. I would say through the mail would be unopened. Call centers were just impersonal and not giving the depth of information. And what we found, I mean, the big finding for our study was that people have a really strong preference for in-person assistance. They're looking for people who are unbiased, so not necessarily employed by a single health insurance company. They're looking for people who are knowledgeable about health insurance, but also people who are from the community, who can understand the needs of the community, and other things like trustworthy, compassionate, and so on. So essentially what we're talking about is a model of community health workers. So that's the finding from our study that we'd like to, really put out there, is community health workers are the way to convey health insurance information.
And what is a community health worker? It's
a person who lives in a particular community, who's focusing on helping community members with their health. They're not necessarily medical staff. They're more like navigators to help people get the information they need.
So ombudsman. Sort of.
Yes.
So if you live in the California neighborhood or the Shawnee neighborhood, you want somebody from your neighborhood or from West Louisville to be sitting down across from you and telling you, all right, well, I don't have the answer to that, but at least I know where I can point you to and where you can look and help you navigate how to find out if your gallbladder surgery can be done by this doctor over here or this doctor over here and how much it's going to cost, right?
Yeah, so they kind of link the community and the healthcare system and connect the community to different resources. So
is that realistic? To think
Absolutely.
That you can go hire these folks, or are health insurance companies willing to spend the money to?
Yeah, to be honest, I mean, we already did a version of this in the state of Kentucky with connectors, but the connectors have really now I believe they're called assisters, and I know a number of those people have been kind of withdrawn. But I think that connectors, whether paid for from the federal level or at the state, really did a good job of signing people up for health insurance in a non-biased way. So I think that that model is there, and those folks are very useful.
Again, we're talking with Ryan Combs and Baraka Muvuka, who's with the University of Louisville. They're both with the School of Public Health and Information Sciences. They've been looking at health insurance literacy gaps, particularly among African Americans. So what's the outcome of all this? What does it mean in terms of the folks that got some coverage under ACA? Are we still not doing a good job of figuring out how to get them into the healthcare system and get the preventative health care? Is that the bottom line here?
I think surely there's a gap. There are health insurance literacy gaps that are stopping people from getting and using the care that they need. So my personal recommendation is let's train the existing community health workers, let's train nurses on health insurance and health systems literacy so that they can help the people they serve.
Okay. Baraka, your thoughts?
Since we are actually undergoing changes in our healthcare system in general, it is very important or very critical that we actually address health literacy so that people can be able to navigate these changes. Otherwise, people with limited health insurance literacy will have difficulty adapting to new systems.
Right. But oftentimes this stuff takes money, right? So to hire folks and to get face-to-face meetings between the people who are using the insurance and the people who can help them access health coverage, right? So.
Absolutely. I would also say that people with increased health literacy have better health because they're able to make decisions on their health. So the benefit, from a cost-benefit point of view, this is actually a fairly small expenditure as compared with the improvements in health that you can gain.
Right, preventative health and those kinds of things. Okay. All right. Well, Ryan Combs and Baraka Muvuka, I appreciate you being on the program. Thanks for listening to UofL Today with Mark Hebert, and go Cards.